I wanted to start by saying happy belated FOP Awareness Day. I hope you all had a chance to celebrate this great occasion that comes once a year on April 23rd for our community to go out and spread awareness about FOP with their community. This topic of awareness really ties really well hand in hand with today's topic of strengthening your support system because there's a lot of overlap. In order to bring people into your network or help them understand where you are in your journey, they need to understand FOP. So we're really happy to be able to kind of tag today's program along with that resource. I am going to let our panelists introduce themselves in just a minute, but I wanted to start by saying that when you think of a support network, it's kind of a very broad idea and a lot of us may have a hard time applying to our direct day-to-day life. Today's panelists are going to speak about three different sort of areas of life that it's important for us to seek out support in. So in our personal connections with one another, that may be your significant other, your spouse, it may be a close friend. And Yasela is hopefully going to be able to speak with us today about that. Her husband, Jimmy, had a work commitment come up, so he's not able to join us live, but we do have a recording. He was featured in an Awareness Day video, so we're going to hear from him briefly as well. We have John joining us. He is going to be sharing a little bit about his experience building support in more of a local area. So not only do we want those people who are really close to us, who we have those intimate relationships with, but we also want to have those people who are in our community, just our local area, who we see maybe not every day, but throughout our week and are able to support us outside of the home with less personal topics. And then last, but certainly not least, is Sunil. So Sunil is going to be speaking more about how we can find support on a regional, or in his case, a national level. And so I'll let him, Sunil, do you mind starting us off by introducing yourself, your family, where you live, and maybe a little bit about when you sort of came to the FOP community?
Sure. Thank you. Thanks, Hope. And good morning and good evening to all the people who have joined here. I know some of them from India and some from all over the world. It's nice to connect with all of you. Uh, to start off, I'm based in India. I'm Sunil Ladva, and I live in a tech city, which is called the so-called tech city of India, that is Bangalore. And I've been here for 22 years now. And my daughter Khushi has been diagnosed with FOP. She's 12 years now, and she was diagnosed when she was around 3.5 years old. So since then, it's been a long journey. It took us a few years to even understand what FOP was, and finally, we got most of the things right, and then we were able to connect to the relevant doctors and families, and then form an ecosystem for all the families here in the past 2 3 years. With a lot of support from IFOPA, we have finally got our act together, and a lot of interesting things happening here. And a couple of years ago, we thought that we should have a registered group. And last year, we started a group of all the patients' families called FOP Trust. It was formed last year, and now there are around 70 families whom we have identified. 3 years ago, when we started off, we were around 27 or 28 families. But with the help of a lot of caregivers, doctors, and reach out from many other agencies, we were finally able to get to around 70. And in fact, we almost um, interact with a new patient on a monthly basis. Some people come to us through the website, some search for us on the web, and some are, of course, referred to by IFOPA. And it's been a interesting journey so far. Hopefully, we connect more. But initially, when we came to know this disease was mentioned as 1 in 2 million, now when they say 1 in million, I always think and look for that we are 1.4 billion country. So there could be 1,400 patients here. So we are always wondering how should we connect all those 1,000 plus patients and how do we get to know each other.
Yeah. That is an incredible mission, and I am so excited, Sunil, for you to share more about the logistics of how you've done that in our conversation today. Let's see, John, would you like to go next to introduce yourself and
Sure.
your family?
Yeah, thank you, Hope, and thank you for everybody for being here and participating in this. This just helps build the community. Everybody here is part of our community. My wife in our immediate family, it's my wife Erin and our son Lucas, who is 5, and our son Ethan, who is now 4. He is the individual living with FOP in our family. And he was diagnosed at 2.5. Of course, we kind of had a lot of mysterious lumps and bumps that we couldn't figure out, and the classic FOP toes when he was first born. And finally, we saw a special lumps and bumps specialist at Children's National in Washington, D.C., which is fairly close to our house. And they eventually just diagnosed Ethan with FOP, or highly suspected it. So we were thankful, very thankful that doctor got in touch with the IFOPA and actually Hope reached out to us the very next day. So that was such a huge relief for us, knowing that we had that support right away, and, from the get-go, from day one. And of course, we were very shell shocked at the beginning with Ethan's diagnosis, and knowing that the IFOPA and the people were out there to help support us was just such a great thing, and we were very thankful for it.
John, do you want to share a little bit as well about the event that you held recently to not only raise awareness, but I think do some financials or connect your community to the opportunity to provide some financial support for FOP research?
Yeah, so when Ethan was first diagnosed, my wife and I, we were absolutely kind of against fundraising. We just weren't ready for it mentally. And so really what we did shortly after Ethan's diagnosis, somebody had actually, I'm part of a group associated with the church. It's a Knights of Columbus, and they had actually offered to host a fundraiser, and we weren't there mentally. We needed to get over our kind of grief process, our that initial shell shock, like I said. But towards I guess it was last summer, that kind of came up again, and somebody approached us if we would be willing to do a fundraiser, and we said, you know what, let's give it a shot. And it turned into something so big and so much more than we were anticipating. And we are very, very grateful for it. We hosted we called it the Bingo for a Better Tomorrow. It was just a bingo event. We had members from the FOP community from about a 50-mile radius join us for the event, which was fantastic to see FOP families coming together. And we were able to raise, I think it was $37,000, for our first event, to be able to put forth to the FOP or the IFOPA. So that was really one of the things that we felt like we were able to do to help to start to make a difference.
That is incredible. And I want to say it is a huge success, and congratulations to you and your family and your community. And to anyone listening, don't be intimidated. You don't have to, if you're thinking about, starting off on a venture like John and his family did to raise funds. It does not have to be that scale of event, but it was incredible to me, John, that in the short time, and I appreciate you speaking to really what the process was for you to get there, that even though you're relatively new to the community, it wasn't the first thing that popped into your mind, but that you took your time to really adjust and do it when it was the right fit, the right time for you. So thank you for sharing that.
Bueno, vivo en Turbo, Antioquia, Colombia. El nombre de mi esposa es Gisela Paula Quinto Bolaño, llevamos 5 años de estar juntos. Cuando yo la conocí a ella, Gisela, su enfermedad realmente no estaba muy avanzada. Ella tenía una movilidad normal como cualquier otra persona. Una chica joven, con muchos sueños, con muchas ganas de vivir, muy feliz, muy introvertida. En esos momentos Gisela ya estaba estudiando, ella quería ser una profesional de la enfermería. Gisela sí se la ha visto mucho en enfermedad porque disminuido mucho en su movilidad, poder levantar sus brazos, poder peinarse, poder ir al baño y todas esas cosas del diario vivir que hace una persona normalmente. Eso ha sido un gran reto para ella porque ella siente que sus sueños se le escaparon de sus manos con solo el hecho de que ella tiene que recibir ayuda de otra persona, en este caso mía, tal vez de su mamá ocasionalmente. Entonces eso a ella le ha afectado mucho mentalmente. La idea es que esas personas se sientan comprendidas, que esas personas se sientan apoyadas, que esas personas sienten que son valoradas. Me gustaría que las personas pudieran llegar a conocer la Gisela, que detrás de esa apariencia, de esa enfermedad que ella padece, fue una gran mujer, es muy inteligente, muy amorosa, muy cariñosa, con ese don de servir, esa filantropía que la caracteriza a ella. Mi sueño para mí, para ella, que ella sea muy feliz, compartir muchísimos años, que podamos viajar, que podamos conocer, que podamos compartir, que, que seamos felices hasta que Dios quiera.
Well, thank you so much, Yasela, for sharing your family with the IFOPA and the FOP community. And it's an incredible video. And I hope that we can continue to get, I know you can hear us. You just haven't, you're not able to hear us in Spanish. So hopefully we can get you onto that Spanish audio and have you join some of the questions that we have coming up. But John, I wanted to go back to you to sort of, now that our attendees have had a chance to meet you all and learn a little bit about sort of your background, where you're coming from in this support system picture that we're painting for today. Can you talk about what some of the baby steps, so to speak, were that you took as you were starting to really actively and consciously think about how you could spread awareness of FOP with others and maybe help other people be a little more understanding of your family and Ethan's needs?
Yeah, that's actually really it really starts from the beginning, from even just our, once we were diagnosed, just slowly starting to text family members. We were really kind of keeping it close to our family at first, our immediate family, and then kind of going spreading out from there. But we realized we wanted to focus in on our closest friends and our closest family to kind of start to include them more and more, and then it just kind of spread out after that. One of the things that really helped for me once I kind of got over those initial feelings of just learning about Ethan's diagnosis, was I kind of made a personal goal to sort of talk about FOP, or bring some awareness to FOP or Ethan's kind of journey every single day. And one of the ways I was able to do that is by the little cards that the IFOPA has. Those cards are really helpful. I would try to give out at least one card a day, or I'd leave it on a table somewhere. And then for all closer friends and family, of course, the bracelets are just such a great thing, to be able to start to really they're definitely a conversation starter. And I don't know about other parts of the world, but in the United States at different times, the bracelets there used to be yellow bracelets for Live Strong. It was such a popular thing. And they are really such a great conversation starter that nowadays you see somebody with a bracelet, you can really start to open up, ask them what their bracelet is about, and if it's for a cause or a disease or some type of awareness. And then usually they turn around and start asking about what these bracelets are for, and you can kind of expand. I've been able to expand on that and to really tell them about FOP, and usually that brings up a very lengthy conversation about what it is, and just really about the awareness. And then gradually, we were able to link up with the IFOPA and have these kind of cards made more individualized. That's Ethan's back and toes, and picture of Ethan here. And this is really a personal thing, and I've been able to hand these out. I keep them on my desk at work. Just anybody that stops by, just to be able to really still kind of bring awareness almost on a daily basis. If it's front and center, then people want to ask about it. And from our experience, when people start to ask or they see about the bracelet or the card, they really want to know. They have a vested interest, especially because it's such an unknown. FOP is very unknown in at least around in our community, that it just people are curious. They really want to find out more. One of the things we also did was we included a couple days after Ethan's diagnosis, Aaron and I met with the school, the daycare where Ethan was attending at the time. We had lots and lots of meetings about how we can keep him as safe as possible, and and all the staff there, of course, they were very, very supportive, and they wanted to have a other fundraising, bring awareness to all their staff. And I know they had many meetings about Ethan and about FOP and the safety concerning FOP patients. And we've actually met with Ethan's school now quite a few times about all of his needs, and then they spread awareness and keep it going. Even Ethan's teacher just did a walkathon this past weekend, and it was a great event, great turnout, and it was just again it's just spreading awareness more and more, and now we feel very comfortable about sharing our story. It's still very personal, and it hits home at times, but it really, if we don't share our story, then who will?
Yeah, and I forgot to mention this at the start, but we did a webinar last month with a social worker and a therapist, and she really talked about, what does that look like going from zero to speaking to others about awareness? Because it is a really intimidating thing. It's not an easy skill that comes naturally for a lot of us to walk up to someone and tell them. And John, when you shared that, you would just leave a awareness card on the table at a restaurant, or that you started with the people who were closest to you, who you felt most comfortable talking about FOP and about Ethan with, like that kind of it helps you build up the confidence then to move out and talk to more and more people. And I know you mentioned recently that it's gone to like the next stage of your line of duty or your area of employment, that you're even connecting or sharing awareness with a broader group of folks through that channel. So people who you've never even met before, who you may not meet, are learning about FOP through that as well, which is really incredible. So Sunil, I'd love to hear a little bit about, what your thought was, or what your guys's path to creating FOP India and the system you have now. When Kushi was first diagnosed, what did you feel like you needed, and what do you feel like the families who are in the same position as you in India need first? Like, where did you sort of start your lines of support?
When Fishy was diagnosed, at first it was like John said, initial few months were denial that this cannot happen to my child, right? The initial reaction is denial, and then finally, when you accept it, you start looking for a support system. How do I meet people who are already undergoing all this, connect with them, understand from their experiences? and learn more about this so that we can finally, like, reach a level wherein we can build a community around this and interact with each other, share each other's thoughts and experiences. Of course, the doctors are there, but this is such a rare disease that the doctors can only support in case there is a flare up. Otherwise, there is nothing much routine which can be done other than waiting for the next flare up, right? And that's pretty painful. So after the diagnosis of Kushi, we reached out to Dr. Isha and a couple of other doctors, and some amount of research was done on the internet. Then came across a few families, and we met first virtually. That was during COVID, and initially when my daughter was diagnosed, it was pretty long ago, and there was not much traction, and we were unable to connect to most of the families. After COVID, most of the world moved virtual, and we were able to connect with each other virtually like we are doing now. And that is when things started taking shape in a structured form. And in 2021, we had our first family gathering, which Karen also attended from IFOPA. Then we had Tin Soldiers coming in and all that. Sorry, 2022. That is when things really took off. And from there, we started building a structured organization and a couple of WhatsApp groups and channels, wherein some part of the channel where the doctors were a part of the group. And a support system internally for the families, wherein in case there is a flare up or any help is required, it was usually peer support, wherein each of the families supported each other. And we have been trying to find out more relevant resources which can be used to help the families more, and see if the doctors also can support in this endeavor with a standard treatment protocol. And we are in the process of getting into some virtual consulting and all that. I will come to that later. So it was a challenge, but now I think finally now with one full-time associate of ours, Mr. Selvakumar, who is also on the call. So he's a very experienced person in matters related to orthopedics, and he's been a great support. We've been able to interact with more families, and I feel we're just getting started. There are a lot more things to come.
Yeah, and you mentioned that WhatsApp group and the ability to connect. I mean, the doctors are obviously incredible. We value our FOP experts and those people who provide that insight around healthcare and managing that aspect of FOP. But there is something about the day-to-day living with FOP that it feels like only the community itself can kind of help support one another in to the highest degree. And so you said you had started this WhatsApp group, so families had a place to come. And if you're not from India, which I realize that all of our attendees are listeners for future recording of this video may not be, there are support groups on Facebook. There are some support groups that meet monthly. We have a support group for caregivers and for adults with FOP, and then the support for FOP Facebook group is open to everyone. And I can't say enough about how incredible those resources are to provide that place for people to come and just ask the questions that only someone else who has a loved one or who has FOP themselves has kind of lived through and can share their insights and experiences on. So it's great to hear, Sunil, that you had such a good pulse on the needs of your community and were able to meet that off the ground. So, Gisela, oh, sorry. I think we have the translation worked out now. So I'd love to hear more about how, as your FOP progressed, and you and Jimmy had been together for some time before your FOP became more limiting. It made mobility a little bit more difficult. How was Jimmy a support to you during that time? And especially, from an emotional standpoint, how did he help you stay positive during what's a really trying time for most people with FOP? Oh, and you're on mute. You may have to unmute so that our interpreters can hear you.
Well, first of all, I was diagnosed in 2019 in February. And at that time, I was not with Jim's. I mean, he lived across the street. And then in 2020, we started dating, and my, the FOP had progressed a bit. And I can tell you that he has been my biggest support whenever I'm sad, whenever I'm depressed. He gives me words of support and he helps me with everything because I live with him and with my father. So he is my go-to person. He is the person who supports me the most because for my daily activities, he's the one who helps me because I find it very difficult since I cannot lift my arms or do my hair or get changed. I always need him, and I always thank God because he's there with me and he has supported me and he has been the biggest blessing in my life.
Oh, yeah, it is incredible. It was very moving for me to watch the interview because I was there as they were interviewing Jimmy for the Awareness Day video, and you can just see how closely you two are tied together and what a wonderfully supportive relationship you have. And for you guys, he's your husband who you live with and you're able to see him every day, and that's wonderful. But that doesn't have to be the only way. If you're, again, someone tuning in and you're not married, you don't have that significant other who's there with you. It doesn't have to be someone in person. It can be someone who you've met virtually and have just really connected with and developed a relationship over time. But the most important thing, and we talk about this in the resilient living programming that we do here at the IFOPA that focuses on our mental health and well-being, is that it's important for us to be able to share our emotions, right? Not to bottle them up, not to stuff them down or feel like we have to keep them to ourselves. It's really important that we're able to openly communicate our needs and how we're doing to other people. And so whether it's someone who lives at home with you, like Jimmy and Yasela, or someone who you've met online and just have a close relationship with, that very personal sense of support is really important for our mental health, which lots of people think then goes to impact our FOP progression. So, I can't put enough emphasis on that. And I thank you so much, Yasela and Jimmy, for sharing your experience in that area. So I want to come back to you, John, to talk about, it's in a larger scale, looking at people who maybe aren't as much a part of our intimate everyday life. There's a lot of education that needs to go into helping them understand FOP. Like if they're not able to see the day-to-day impact of it, it can be hard to grasp how new bone growth can impact someone's life. So how did you educate the businesses or the attendees at the bingo event about FOP and to help them really understand it?
Well, from the get-go, we were kind of really trying to figure out how we were going to do it. We were very fortunate that Dr. Kaplan said he was going to be in attendance, so we're like, yes, this is going to be great. He's going to be able to help explain it, but we really wanted to have some kind of visual for everybody. And thankfully, we were able to we narrowed it down and utilized the Science Made Simple video that the IFOPA has. I think there's probably a link on it on your website. And it was actually pretty amazing to see because you could just see in people's minds that they were able to get it. They were able to understand what FOP actually is. Afterwards, I had a friend come up, a very close friend actually, and he was like, after he watched the video, he said, John, I actually finally understand what FOP is and how it works. Like I because of the video. So we've actually been able to send that, Aaron and I have been able to send that to a lot of family and friends when, that when we just can't get the words out or really truly can't fully explain it. We sent the link to that video and people truly understand what it is afterwards. Also, we did with the businesses that we had that were kind of associated with the with the bingo event or just other people in the community, we've I've written, basically like a little blurb about Ethan's diagnosis and about what FOP is, with links to the IFOPA and to that video of Science Made Simple. And that's how we've kind of tried to educate, starting our community, as well as different civic associations around the Annapolis area, around Maryland. We've sent them information about Ethan and about FOP. I've actually been asked to give a speech at a local civic association. They were having a monthly meeting, and they bring in somebody from the community to speak on whatever topic. So I was very fortunate enough to be able to even talk to a small group of people. I think there's 50 or 60 people, and try to bring in, explain about FOP. And the way I look at it is just 50 or 60 more people that can spread the word about FOP. Just that awareness level can start small and just kind of gradually build on and build out. Meanwhile, all of that, one of the big things that we've tried to really push is that Ethan is a person, and he is a fun-loving, really really silly little kid. But at the end of the day, he just happens to have FOP. His FOP does not define him. It is just part of who he is, and that's really important to be able to let the community know that, because sometimes disabilities can really define somebody, and that's not the case.
Yeah. Well, and again, John, it's incredible to hear how far you've reached, and sort of like the gold standard. But for anyone listening, I know it can be hard to find those organizations and to know the right channels to spread awareness from. So, if you're here in the United States, there are lots of organizations like Global Genes, Every Life Foundation, NORD, the National Organization of Rare Disease, that offer lots of opportunities for people to get involved and share their perspectives. So that may be a good avenue of awareness. And if you're an international community member listening in, a lot of different countries have rare disease associations or organizations. So looking to see if there's a rare disease group in your country, and starting there to kind of maybe reach out and see if they're aware of FOP, because they may never, even though they're a rare disease organization, they may never have heard of it. But yeah, those are great examples, John. It's just incredible to see what a man on a mission, a family on a mission can do to help others understand FOP, and ultimately just, broaden that level of support that you have when you're in those different areas
Well,
of
thank you. And we actually feel very supported by the IFOPA to you guys kind of have our backs to be able to push the information out. You make it a lot easier. So thank you.
Good, thank you. Well, Sunil, do you want to talk a little bit about, specifically within the healthcare area, how you have worked to help bring more support to the FOP community in India? How have you kind of brought those people who are, I think, in most families' eyes, like their healthcare team are the most important members of their support network? So how have you brought those together for your families?
We initially, when we started reaching out to people, we started a WhatsApp group, and then we were able to connect to most of them. And emailing and other things are a little challenging here, because initially internet was not so good, and most people don't have smartphones or access to laptops. So that is a challenge. And the bigger challenge was India is a multilingual and multicultural country. We have officially 827 languages. So that's a big challenge. And each person is from a different part of the country, and getting them to work on a common platform, making them understand the importance of connecting with each other so that we form a support system. All that was challenging, but finally, I think we are able to get around, and we are converting the treatment protocols in multiple languages and trying to reach out to different areas of the country with somebody who can help out with the local language, local culture, and all that. So it's challenging, but I think we are finally getting there. And then the two family gatherings have helped a lot, building bonds among people. And then because we had people coming in from all the parts of the major parts of the company, east, west, north, south, and we've been working with them to in turn connect to the nearest family or community or patient so that they can form a local support system there. And in fact, even with the doctors and all that, we are trying to see. But the patients down the lane, some patients have challenges reaching out to doctors and all that. And that is where we, a few months ago, started a program wherein it's a doctor on call, wherein the patients, all the patients in the country, have access to a FOP trained doctor via video call. And that's like, on 24/7. That is what we are doing. We already added a couple of FOP experts. Now we are in the process of adding a gynecologist, a dentist, and many other like, doctors, so that the families get consultation right sitting at their home, and they don't need to travel. And in fact, most of the times we even ensure that medications reach them so that they don't have the stress of searching for medications without a prescription and all that. That is one important thing. And then last December, we had our second family gathering wherein we had invited Mr. Selvakumar also to join us. He's a prominent social worker, and he's very well aware of most of the orthopedic disorders. He's had almost 35 years experience in all this. So with him on board, we have started reaching out to families, and he personally goes, meets the families in their homes across the country, and takes data from their house. What are their basic needs? What support do they require? What are the financial support system they require? And what is the health support system they require? What is the emotional support system they require? What is the livelihood support they require so that they are self-sustained? It is a one-time gig that you can give, donate, get the money, give, but it will not sustain. We'll have to think of something wherein the family and the patient should be able to sustain for a long time. So we have been working on a lot of initiatives. We've been reaching out to like-minded people, like-minded friends, and families. So that is where we are going, and I think we have done a good job of, especially the doctor on call, wherein patient, like, all the patients are really glad that they have somebody to talk to. Earlier, there was no chance that they could get to a doctor.
Yeah, that
Even for the
difficulty.
simplest of ailments, they could not go to a doctor because they were not able to get out of the home at all.
Yeah, that difficulty finding a doctor who knows FOP is something we hear about a lot from families around the world. Not as much here in the United States, which is very fortunate, but for our international families, that is a huge barrier. And so the fact, Sunil, that you guys have made this model of the doctor on call and the social worker on staff is, again, sort of like a gold standard that I think it would be wonderful for every country to have. It takes a lot of work. I'm sure you can attest to that. And a few of the resources I wanted to make sure to point out, not only you mentioned Dr. Midhuri, who is the ICC or the FOP expert. She's a member of the International Clinical Council on FOP. That group is 21 medical professionals who are all experts, and they work together very closely to support patients around the world. So if you live here in the United States, we have 4 ICC members here in the US, but we will share their contact information. And if you're outside of the United States, you can certainly reach out to them and they'll help connect you to someone who can advise your local healthcare provider on care. There's also, and Sunil, I know you use these in the training of the doctors that are a part of your Doctor on Call program. There are continuing medical education units that, every doctor, every healthcare provider has to do that continuing education to keep up their credentials. And different sponsors, different pharmaceutical industry members have invested to create different versions of those for FOP specifically. So on our website, we have a list of CMEs that you can share with your healthcare providers for them to learn and understand FOP better. But I can't, one thing
We've
that
been doing that.
Yes, you guys are on top of it. So, one thing that I can't stress the importance of enough, though, it's great to have those people who are doing virtual consults and you're going to your hospital, hopefully, to work with your medical, your doctor. But having someone like Selva Kumar who comes to your home is sort of the next step. You know, whether it's a social worker, well, social workers are Selva Kumar, I hope you hear this often that you guys are angels because you are able to address so many different areas of life. There are also physical therapists or occupational therapists or home health nurses who will come to your home. And it's just valuable to have someone come to your space because they're able to identify maybe some other needs that can be met, some other adaptations that can be implemented. So whether it's a social worker, whether you can ask your doctor to help refer you to social work services, or if it's another complementary team, healthcare team member, like an occupational therapist or physiotherapist, bringing someone to your home to see that environment is a, excuse me, it's a great next step of care. So Yasela, thank you for your patience. We've been ping-ponging around. So you all have been wonderful to listen and hopefully you're learning from one another today as well. But I wanted to come back to you, Yasela, to see if you could share a little bit more about, you know, as FOP progressed, you shared and Jimmy pointed out in his video that you experienced some intense progression and especially your shoulders. And that had an impact on caregiving needs and just your day-to-day activities. And it also can have an impact on our relationships, right? Especially close relationships with friends or significant others. Do you mind sharing a little bit about how you and Jimmy, even when you were going through those really tough times, how did you guys work together to keep your relationship strong? Oh, and Yasela, you're on mute. So you might have to come off mute so we can hear you.
Well, you know, if OP constraint to your life, it creates limitations at the physical and emotional level, but mostly the limitations are mainly physical. But if you allow that to get to your head, to your mindset, to your emotions, that's when imbalance takes place. And I think that we have a very nice relationship. We we appreciate each other. Yes, I got diagnosed with FOP, but he sees me with the eyes of love. He doesn't see me as a person who's uh, ill. He sees me with love, with kindness and tenderness. That's how he sees me. And I oftentimes do feel frustrated, to be honest. And he just lets me be, so we don't get into discussions because he- I can't get stressed. We all know I can't get stressed. So we use words uh, related to our home. Whenever we engage in a conversation, we are pretty grateful too. And I know that there are no barriers for love. That would be it.
Well, thank you, Yasela. And yeah, the gratitude goes a long ways. So to hear how you've been able to implement that appreciation for one another into your relationship, that is critical. But also hearing how Jimmy, you know, recognizes that you're going through a lot sometimes and that you also need your space, is a really important thing to keep in mind. So thank you for sharing that. I know it's a very personal relationship and a personal experience, but I think it's helpful for others to be able to hear these sort of tips for how you've navigated it. In closing, I know we're coming up on time and I apologize again for the delay in getting started. Thank you for all of you who were in the waiting room while we worked out some technical kinks. But I wanted to give our panelist here today just a minute in closing to kind of share, you know, do you have any advice, any one piece of information, any sort of mantra or message that you would share with other people as they're going about kind of trying to build these supportive relationships? So, Sunil, do you mind starting us off?
Yeah. Uh, Unlike other countries, we have challenges here in terms of different states, languages, cultures. So it was a big challenge for us to bring all the families together and get them on a common platform. So I feel it is very important that the same may be the case in some of the other countries also. We started off with a WhatsApp group, but I feel that other than the WhatsApp group, there should be a personal touch also, because that adds a lot of value. And that particular family feels wanted and feels that somebody is there to support me, somebody is looking after my back, right? That's very important. What we have realized in the past few months, when we connect with them on an individual level, they are so overwhelmed, and we just see them. Some of them just cry, like, that there is somebody to look after us, and that is so fulfilling. I cannot explain it in words.
Well, and if you're not from India and you're not lucky enough to have that in Sunil, if you're from somewhere else outside of the country, and maybe you don't even have a national organization, which I'm going to share a list of those in our resources slide next. But the IFOPA, myself and my coworker, family services coordinator, Melissa Davis, who's an occupational therapist by training, we do those calls. You can connect with us over email or Facebook or WhatsApp. And we are happy to schedule a Zoom call so that we can see one another. We can book translation support if that's helpful for you. And we can just have a conversation about, what life with FOP has looked like and how maybe we can find some resources to support you in different areas of managing that care. So, Sunil, thank you so
In
much
fact,
for sharing.
we have patients from Bangladesh and Pakistan also being a part of our team now.
Yes. Diverse. That is a good point to make, that a lot of national organizations welcome people from outside of their country. So we can help connect you to those, or maybe you're already in touch with one, but regardless, we'd still love to have that personal connection on behalf of the IFOPA as well. John, do you have any words of closing advice for our attendees about really connecting to that support, maybe at a smaller scale, more local level?
Yeah, I would say just start. What worked for us is going to work different for other people. To kind of keep that in mind. So for us, like I said before, our support system was, our family and close friends, and then kind of building on after that. So I would say just move at your own pace and do what you feel the most comfortable. If you don't think you would connect or that somebody could relate to you, then maybe kind of give them maybe a little bit of a information about FOP, but you don't have to go into detail. So do whatever's the most comfortable. And also one thing that I've kind of learned and still trying to learn and grasp is don't be afraid to ask for help. Right after Ethan and I, or right after Ethan was diagnosed, Aaron and I started seeing a grief counselor, because it's kind of a grieving process. You have a very traumatic event that, life-changing, life-altering event, with the diagnosis. And so just we reached out for help in, to help us get us through that, as well as seeing personal counselors is definitely helpful. And even I wanted to add that the IFOPA had posted something at one point about a rare men's disease group and their caregivers. It's an international group, and I joined that group, and it was exactly what I needed, but it might not be what you needed, so or what you would need. So I would just say do whatever you can to kind of stay in touch with things that the IFOPA puts out or other social media outlets, and then do what makes you feel the most comfortable. If it doesn't feel comfortable, then it's okay. Just wait for some time, and maybe you'll feel comfortable with sharing your information or your story, or your building that support just at a later date.
Thank you, John. And yeah, I'm a huge proponent of bringing paid mental health professionals into your support system. That is, a lot of times we feel most comfortable going to a friend or a family member, and it's great to have those relationships as well, obviously. But mental health professionals have that additional level of training to be able to provide sometimes some techniques, or just for you to be able to go to someone who you don't have to worry about, you know, taking your burden and placing it on their plate or overwhelming them when they're already doing so much to help support you. So thank you so much for advocating for that. And if you need any help connecting to a mental health professional, the IFOPA has some great resources. We have some directories of different healthcare professionals that work with different insurance plans and things like that. So please don't hesitate to reach out to me if that's something that you're interested in learning more about. And Yasela, in our last message from our speakers, I was curious if you have any words of wisdom or any advice for people who are building that support system in a very personal, emotional sense.
Yes, thank you. So first of all, I think that people should be more empathetic and to encourage people to express what they're feeling, to accept their limitations, and accept that we face many challenges in life and that every day we keep on learning more and more.
That is beautiful. I love the insight and just that, encouraging people to really, again, sort of along with the mental health professional line and the resilient living framework, to be accepting of their emotions and to be willing to share those with others, and for those who are receiving those emotions to be open and available to them. So I wanted to share before we all jump off just a few resources, and I'll send this out to registered attendees after today. So I have here links to some of the things we've talked about, the resource webinar that kind of walks you through from the social worker and therapist perspective, some of the things to keep in mind as you're sharing, disclosing your FOP diagnosis, and also just taking that kind of brave step sometimes to reach out and include others in your support network. Some information about Awareness Day. If you missed it this year, it'll be back next April, and we hope you'll use it as an opportunity to not only raise awareness about FOP, but to extend your support network. And the awareness materials that John mentioned. So there's the cards, the tattoos, some little Cure FOP tattoos, and the bracelets as well. A link to the ICC on FOP so you can all connect with those professionals, as well as the national organizations like FOP India that are near you. And then the Science Made Simple video that John mentioned as well. And I'll add, I didn't have the CMEs on here, but I will add that as a follow-up to the great resources that Sunil shared earlier. So with that, I am going to end out our second part of the advocacy series for 2024, Strengthening Your Support Network. Please stay tuned for a podcast that we'll have coming up in the next couple of months. Our podcasts really do a deep dive with a community member to hear more in depth about how they've gone about strengthening their support network. And they're incredible resources to listen to on the go while you're driving if you don't have time to sit down and watch a recording. So please stay tuned for that. And we hope to see you all or connect with you soon.